All right, party people. Today, we're going to be covering Staph aureus and everything that you need to know on this bacteria to score high. Let's get it. So, first and foremost, let's start with an overview of gram-positive cocci. Look at this chart. You don't necessarily have to memorize every aspect of it, but a lot of it is just getting yourself organized in terms of how to mentally approach and categorize all these different bacteria. Staphylococci are catalase positive. Streptococci are catalase negative. So for Staphylococcus species, we have Staph aureus is coagulase positive. You must memorize this. What this means is that it completely clears on blood agar. Staph epidermidis and Staph saprophyticus are coagulase negative. Staph aureus appears as a gram-positive cocci in clusters. Think of a bunch of grapes. It's also referred to as golden staph due to the yellow pigment. The yellow, it can also be remembered because the symbol for gold is a U. So golden staph, Staph aureus, makes sense. If you have a yellow-colored skin infection, think Staph aureus. Do not confuse this with Pseudomonas. Pseudomonas produces a blue-green pigment. This is due to pyocyanin, and this is particularly prevalent in burns. Do not mistake yellow pigment for Pseudomonas, two completely different bacteria. In terms of skin infections, Staph aureus can cause cellulitis. This is the most common cause. It involves the dermis and hypodermis, usually pink in color. Next up, we have erysipelas caused by Staph aureus. This affects the dermis and dermal lymphatics. This appears as fiery red. This is more often caused by group A strep. However, it can also be caused by Staph aureus. In terms of impetigo, this is known as school sores in children. You can have bullous and non-bullous forms, and previously differentiated by organism, but Staph aureus is now considered to be the most common cause of both. Now, in terms of treatment, for cellulitis and impetigo, think cephalexin or dicloxacillin. Do not mix this up with doxycycline. You can also give topical mupirocin. This is a USMLE favorite for impetigo. For erysipelas, it is treated the same as cellulitis, despite it being more often due to strep pyogenes. Staph aureus can also cause mastitis. This is a classic presentation. A breastfeeding woman with red, cracked nipples. Continue feeding anyways, even through the affected breast. A more challenging presentation is a non-fluctuant red tender mass in the upper outer quadrant. This is still mastitis. If fluctuance is present, it's an abscess. That's a distinction you have to know. Now, treatment for mastitis is oral dicloxacillin or cephalexin. Both are safe during pregnancy and can be continued throughout the entire breastfeeding schedule. Endocarditis. Now, Staph aureus can also cause endocarditis. In the case of acute endocarditis, Staph aureus is the most common cause, especially in IV drug users. These patients typically have no history of valve disease. They will present with a fever and a new murmur. As far as subacute endocarditis, this is caused most commonly by strep viridans, aka strep mutans, or strep sanguinis, following dental work. This is more common in people with mitral valve prolapse or other cardiac structural deficits. Strep viridans produces dextrans, allowing adherence to damaged valves. Now, Staph aureus can also cause septic arthritis. If no further information is given, Staph aureus should be your default. If you have a teenager, sexually active, think Neisseria gonorrhea. In the case of sickle cell disease, you have to think Salmonella for osteomyelitis. This is due to the repeated infarcts to the spleen, which loses the body's ability to phagocytose capsulated organisms. But for septic arthritis, if a smear shows gram-positive cocci in clusters, it's still Staph aureus. You have to use your head. Now, Staph aureus can also cause pneumonia. Typically, strep pneumo is the classic cause of lobar pneumonia. However, Staph aureus can also cause lobar pneumonia, especially in the post-influenza period. So, if you have a patient with a history of fever, chills, myalgias, followed by a pneumonia, then you have to start to consider Staph aureus. It can also be a cause of superinfection. Staph aureus can be co-infected with scabies. Now, scabies is caused by Sarcoptes scabiei, and with this, you have to look for linear burrows. Staph aureus is the most common superinfection, especially in immunocompromised patients. The treatment for scabies is topical permethrin. Staph aureus can also co-infect with eczema. Now, if it's co-infected with HSV, that leads to eczema herpeticum. Tinea pedis can also be co-infected with Staph aureus. This is relatively rare. However, if you have a fever, lymphadenopathy, and redness tracking up to the ankle, the fever was actually due to the Staph aureus, not the trichophyton. Fungal infections rarely ever cause fever. Let's get into the immunology and toxin. For Staph aureus, you have to know toxic shock syndrome, TSS. This is caused by TSST1 toxin. This is a superantigen from Staph aureus. This superantigen binds to MHC2 and T cell receptors, which results in a massive cytokine release. This is associated with tampons, nasal packing, and wound dressing. So if you have a patient that recently got her period a few days ago, and you may suspect that she forgot to take out her tampon, and all of a sudden she's having all these extreme reactions, you have to think about toxic shock syndrome. Next up, we have staph scalded skin syndrome. This is caused by epidermolytic toxin, which targets desmosome. It's seen in neonates with diffuse erythema and positive Nikolsky. When I say positive Nikolsky, I also want you thinking of pemphigus vulgaris. Pemphigus vulgaris also targets desmosome. Now, Staph aureus can also cause food poisoning. This is caused by heat-stable enterotoxin. Usually has a rapid onset, think of less than 6 hours. Common foods are meats, potato salad, mayonnaise, or cream-based items left at room temperature, so think of a picnic. And then a bunch of the people that attended the picnic get sick shortly thereafter. If it's very close to the time of the picnic, think Staph aureus. Also, Staph aureus produces a protein A. Protein A is a toxin produced by Staph aureus. This toxin binds to the Fc portion of IgG. This prevents the opsonization and phagocytosis that would normally occur. So immunodeficiencies normally associated with Staph aureus. If you have a patient with chronic granulomatous disease, CGD, this is a deficiency in NADPH oxidase. This deficiency leaves the patient susceptible to catalase-positive organisms like Staph aureus, Serratia, E. coli, and Candida. In patients with leukocyte adhesion deficiency, LAD, this can also include Staph aureus infections. And finally, a relatively rare one, but I'll include it for the sake of completeness, is Job syndrome. This is a hyper IgE syndrome. Staph aureus is known to cause cold abscesses in these patients. All right, that's it for this one. Go crush it.